Hi guys, it's Meg again. This is a PowerPoint on special procedures and testing. There aren't very many special procedures and tests that you're going to need to be a part of, but so this is going to go fairly quickly. But we wanted to give you an idea of some of the ones that you may be seeing. The 2-hour post-prenatal glucose means post-prenatal after a meal. Glucose specimen is collected 2 hours after the patient eats a meal. And then the glucose tolerance tests, it's used to diagnose carbohydrate metabolism problems for people with diabetes. The patient must eat a well-balanced meal for 3 days prior to test and fast at least 12 hours before the test. The patients are gonna drink glucose prior to the test and have 5 minutes to finish the drink. Their levels are going to peak within 30 minutes to an hour following this glucose ingestion. Once the patient finishes with the glucose ingestion, the time is noted and the 30, 60, 120, and 180-minute blood specimens are taken. These 4 tubes are drawn on a 3-hour glucose tolerance test, and a normal result for a fasting glucose test is under 100. The lactose tolerance test is the same as glucose. They just have to drink lactose, like what's in milk, to find out if they're lactose tolerant or intolerant. The bleed time test is performed on the forearm and uses a blood pressure cuff inflated to 40, um, and the phlebotomist will use an automated incision device to puncture the skin, and will use filter paper to blot the blood drops. It's a time test, and the phlebotomist will blot blood every 30 seconds until the patient stops bleeding. Um, Obviously, this can be, depending on what medicines are on, it can be anywhere from a couple minutes to an hour sometimes, depending on how big the puncture to the skin is and how many medications they're on. A DNA test is done by swabbing the inside of the cheek, also known as a buccal swab. You may be performing these tests as well as blood type tests.